that would be great. We can also certainly, when we get toward the end of the meeting where we're having more conversation, dialogue, if anybody's uncomfortable, we can stop recording at that point. Just let us know as we go through that. As I was saying, if you have information that you want to share, please feel free to attach documents or put a link in the chat so that we can capture that. We are pretty adept at the mute and the unmute, but I know I often forget and just start rambling without having unmuted myself or vice versa. So if we need to, we'll just kind of remind folks about that. Quickly, the format, what we're going to look at today, we're going to introduce our elected officials. The first part of the meeting, there will be a video, and it's going to primarily focus on issues of greatest concern to the Quabog Hills Community Coalition, and then some questions related to those issues to our legislators, which they have received in advance. And then we'll spend some time talking about issues more focused around the Quabog Hills Substance Use Alliance, and some questions that we have there, some updates. And then really the last, I'm hoping the last good half hour, 25 to 30 minutes or so, if we can, if we need to go over a little, we'll try not to, but if we do, we'll hopefully be able to deal with that. To really then hear some of the comments, responses, and reactions from our elected officials based on what they've heard and the kinds of questions that have come up from that we received in advance. So I just want to remind folks that's kind of the process that we're using. If you have additional questions, again, we can put them in the chat, try to summarize them and get them to legislators, but we sort of pre-planned questions being posed to the legislators so they could see them in advance. And also just remind all of the individuals and organizations, great opportunity to follow up with your particular legislator, either for your residents or your organization or both. Good opportunity after today to send out additional information and or even set up individual meetings with our elected representatives. I know they want to hear more about what's happening on the ground in this region. So that's how we're hoping to conduct ourselves today. And catch me if I forget anything, Jack, as the president of the board of QHCC. We're going to try to lead us through. John Zenowitz is also here. He's a board member, and he's going to lead us through the latter part of our meeting. So without further ado, let me open up and introduce and let them introduce themselves as well, our elected officials who are with us. And let me start with our state senator. So let me start with Senator Ann Goby.
Thanks, Gail, and nice seeing everyone today, and looking forward to sharing the next hour or so with you and listening and having a great dialogue. So thanks for allowing me to be here with you.
Thank you. Let me introduce Jennifer. I hope I say it right. Metch, did I say that right?
You said it perfectly. Thank
and
you.
Here on behalf of another of our state senators, in fact, my personal state senator.
Thanks, Gail. Yes, I'm the Constituent Services Director for Senator Eric Lesser, and I'm happy to be here. Welcome to take your questions back, and I hope have some updates as well. Take care.
Let me get back to my unmute. I think, let me just double check and be sure. I think those are our state senators. If I'm missing anybody, somebody raise a hand. Okay, let me introduce and have them introduce ourselves, our state representatives. And let me start with Representative Todd Smola.
Thank you very much, Gail. It's wonderful to be here with all of you today. I'm delighted to be here with my Senate and House colleagues and other elected officials. I see our DA Sullivan here. Thank you so much. He's always here at this event every single year, and all the folks that come together as we try to work as a team to help the future of the district. So honored to be here with you and look forward to your questions and discussion. Thank you.
Great. Thank you, Representative Smola. Let me turn to another of our state representatives, Representative Jake Oliveira.
Good morning, everyone, and thank you, Gail. I'm Jake Oliveira, and I represent the 7th Hamden District, which includes all of my hometown of Ludlow, most of Belchertown, and parts of the cities of Springfield and Chicopee. Delighted to be here. Nice to join with my colleagues, Rep. Smola, Senator Goby, Jennifer from Senator Lesser's office, and of course, DA Sullivan. So looking forward to the conversation. Thanks a lot for the invitation, Gail.
Our pleasure. Let me just double check and be sure I haven't missed any of our other state representatives, and then we're going to hear from our district attorney as well. But did I miss anybody from a state representative's office? Like I said, I'm going back and forth between screens.
Hi, this is Donna. I work with Representative Donnie Berthium. He just had to hop on a call, so he will log in as soon as he can. I'm just here on his behalf for a little bit.
Great. Thank you, Donna. Really appreciate that. I know he's regularly been part of these meetings. So, and I know how packed everybody's schedules are these days, especially with the State House just opening up and doing more in person, but still also doing virtual work. So thank you. And we'll let him introduce himself when he's able to join us. And let me turn to our Northwestern District Attorney, Dave Sullivan, one of the great partners with the Substance Use Alliance, one of the founders of it.
Good morning, Gail, and thanks so much for bringing us together. And I just want to call out, we have wonderful legislators that have been working on substance use disorder and all the dynamics behind funding and making sure that the community gets the services they need. So thanks to everyone on the call here. So, and again, I think we'll have great conversations.
Great. Thanks, everybody. Just another quick request at some point during the meeting, if you have the opportunity, also, if you want to put your information, contact information in the chat box, we'd welcome that as well. Be sure that you're on our email list and other lists to get information. Let me now turn things over to Jack Patrici, as I noted, the president of the board of the Quabog Hills Community Coalition, the umbrella organization that gave birth to the Substance Use Alliance years ago, and have her lead us through the first part of the meeting.
Hi, everyone. I'm also on the gramophone. Had the tunes when you came in. My name's Jack. It's my initials. Thank you, Gail, and thank you, Abigail, for the work behind the scenes to make today possible. The Quabog Hills Community Coalition offers networking and also a place to seed and nurture new initiatives that benefit the 15 towns that comprise our coalition. We organize our work around the social determinants of health to meet the basic needs of our communities. I'm just going to start us off with a little video that my son made as his contribution to the community that really shows us how we pulled together this past year and also where our outstanding needs are. And then when that's done, takes about 11 minutes. And when that's done, we're going to have some questions from the Community Coalition. And so just let me know if you can hear this, otherwise enjoy. The 10 to 10 helpline is a new resource. It's confidential, it's free, it operates from 10 a.m. to 10 p.m., hence the 10 to 10. People can call it if they have been abusive towards their partners and they want to change. If they're worried about behavior and they're not sure it's in the category of controlling and abusive and they want some advice, someone to talk to, or if you've got a friend and family member and you don't like the way they're treating their partner and you want some advice about how to approach it. It's also there for professionals, therapists or substance use counselors who want to talk through how to integrate addressing intimate partner violence in their ongoing treatment.
Change is hard, but we can do hard things. And you can call the helpline, and there are wonderful folks who will take those steps with you.
I'm Peter Willett. I'm a physical therapist here at Bay State Wing Hospital.
Hi, I'm Sue Mondo. I'm a physical therapist assistant.
We're currently both serving as PPE coaches supporting the inpatient area here at Wing Hospital. Consider getting vaccinated. It is so important. We are seeing more and more sick patients come into the hospital that aren't vaccinated. It's the best thing you can do.
Hi, my name is Ashley. I work here at Wing at the Eastern Region. Please wear your mask when you're out in public.
The state of DV in the rural areas of the Quabog Hills during the pandemic has seen a lot of isolation for our clientele. If they are isolated at home with their perpetrators of abuse, then there's no safe space to make contact with our advocates. Since the pandemic has eased a bit, we're seeing more and more contact because they're able to leave the home. Many of our low-income clients lack the access to housing. How do you leave your perpetrator if there's no housing units in our area for them to go? So our clients, our low-income clients especially, can't leave because there's nowhere to go or they cannot afford where they go. Helping the local towns figure out how to produce more housing units that people can access and get a safe place to go would be great. We saw a rise in restraining orders not granted, especially at the height of the pandemic, because there was no place to send perpetrators. So the judges were reluctant to grant and remove this person from the home. That has since changed, but it's still a factor. One of the other barriers that we see is the lack of employment in the social service agencies that are local. Social service agencies not having employees is causing more problems for our survivors.
Hello, I'm John Zenowich, the Executive Director of the Ware Council on Aging. I guess what I'd like to bring up is sort of the state of seniors here in Ware that we're coming in contact with and some of the concerns that they have. First and foremost on our mind, of course, is the isolation that they've experienced over the last couple of years with the pandemic and COVID being what it is, and everybody else has gone through that as well. But we haven't been able to do as much outreach as we'd like to. And we don't know what we're going to find when we do. People have been sort of isolated from their friends, their families, their social activities, and getting out into people's homes is going to be difficult. And we don't know what we're going to find when we get there. We already have had some incidences of hoarding issues, some decline in mental capacity. And so we're really concerned about the state of mental health and the ability to properly assess and treat mental health going forward, especially in our seniors. Onset of dementia, Alzheimer's, things like that are going to be a big priority for us moving forward. So we want to make sure that the resources are available at all levels to be able to take care of our seniors properly. Also, we're having issues with housing. Senior housing, affordable, low-income senior housing is a problem in this particular area. We have been seeing a large uptick in requests for and applications for senior housing in and around the Ware area. And we know that there's a long waiting list for people that are looking for available apartments. People that are trying to either downsize from houses into apartments, or people that have recently become homeless. So we are very concerned about the housing market here in Ware. And lastly, and not least, is we're very concerned about the community health in general. You know, as a couple of seniors came up to me the other day and brought up the fact that they use community health centers for their health, vision, and dental needs because it fits into their budgets. As low-income, fixed-income seniors, they have to be very careful with how much money they spend on their health in general. And so they end up driving as much as 45 minutes away in order to be able to get their services. So when you look at it and you do a simple Google map search and you see community health centers near me, and you see that they're in Gardner, Fitchburg, Athol, Worcester, Springfield, Chicopee, Northampton, and it makes a giant rectangle all around the Quabog Hills region. And of course, there's a giant hole right in the middle where Ware sits. Community health is an important problem, and that needs to be addressed. It'd be greatly appreciated from the seniors at Ware. Thank you, and have a great day.
I'm working here at the Ware Family Resource Center. We opened a year ago, July, during COVID, and we're here to support families and get them connected to resources that they're looking for. It's actually a diversion program to keep youth from entering into the court system. So we've lost our clinician because she's gone on to bigger and better things, and we're having a hard time currently filling the position because everybody's short all over the place. Currently, the school systems are reaching out to us and the district attorney's office is reaching out to us. They'd really like to see us getting groups back together for the youth that's out in the community because they're struggling socially and emotionally. We need to get these groups back together so that these kids can be together and figure it out. You know, we want to help them as best we can.
Hi, I'm Debbie Ennis. Thank you very much for having me here. I am a local social worker. I have my own business. I've been in business for myself for 20 plus years. I am seeing a huge crisis right now that people may not be familiar with or recognizing. I'm getting 5 to 7 referrals a week. I'm not kidding you. It's coming in from all over. People don't realize that kids get their socialization from school. When COVID shut everything down, they lost it for about, I would say 18 months, at least maybe 2 years. They've lost it. They were isolated at home, and they're isolated with adults who are dealing with all of this. So their mental health needs weren't really being met. People don't realize, and social workers very much realize, we are social creatures. We need socialization. I typically work with teens. I have about 60% of my practice is teens. Right now, it's hovering about 80%. More and more teens are needing assistance. The funny thing is I have a lot of teens who are self-proclaimed introverts. They like being at home, but they're starting to not feel as good. They're starting to feel a little depressed. They're not sleeping well, that kind of thing. And what I'm saying to them is, because you're not being out with your friends. That is it. Kids have, social anxieties about being with other kids. So they tend to keep back and they think they're introverts and they want to be here. No, it's just typical teenage anxiety about being with other people. When we're forcing them to go to school, they don't realize this, they're practicing being with their peers and what to say and how to say it and be a little embarrassed, but realize it's not the end of the world. Now they're not talking to anybody, video stuff. This does not make up for social interactions. They're getting depressed, they're getting sad, they're not eating. The amount of cutting, eating disorders, depression, anxiety has always been pretty high. Right now, anxiety is through the roof, really hitting teens hard. So what is the solution to all of this? And there's a couple that I could think of. Place social workers in school systems. You cannot find social workers right now. There's nobody available. Some people have the idea you have adjustment counselors, guidance counselors, but you need a social worker, and not just one for a full school district. So if they can get some money for that, that would be great. So someone was suggesting to me tuition reimbursement for graduate students, breaks on their loans. You place social workers in school systems, and then they'd be able to get tuition reimbursement for being in that school system. That would help put social workers in the school district. They would be more incentivized to be there. If we're going to be putting social workers in schools, high schools, really important. 7th through 12th grade is very, very important as well. We really got to give the students what they need to not just survive life. You want to live life. So let's give them the tools that they need so they can live life.
There you go. Thanks for listening, everyone, and getting a taste of all that we've done in our community, and then the needs that are still outstanding. Of course, those are not all the outstanding needs. Now, John, who had a starring role in that film, we're first going to hear from John, who's also a board member on the Community Coalition. He's prepared a couple of questions. And John, why don't you read them all, and then we'll have some time just to see if our senators, representatives have any thoughts for you. Following John will be Dane Cutler from Community Action. So I want to ask those who are responding to John not to respond exhaustively, so that we can leave time for each person. And then, so because following this, Gail is facilitating a whole other set of questions. So we want to make sure that we move, that we stick to the heart of our ideas. And I'll be pleasantly interrupting you if I have to move you on. Okay, so let's first hear from John, all your questions, and then we'll take turns hearing from our leadership.
So you want me to read all three at once, or do you want me to go one at a time?
Yeah, why don't you read all three so that people can really digest which ones they're going to respond to, because not everyone will have everything. So.
All right. And if you don't mind, Jack, I'll take the liberty of just sort of assigning a response list. That way people can go in order.
Cool.
In the way that people were introduced. So good morning, everybody. As Jack and I hold a private conversation in front of this whole esteemed gathering. So if you don't mind, I'm going to read off my three questions, and if we'll take it in order as the way you were introduced, so it's no particular order. It's just Senator Ann Goby, then it will be Senator Lesser's Representative Jennifer Mesh, Rep Todd Smoller, Rep Jake Oliveira, and Donna Palmer. I don't know if that's still you or if it's Donnie, either one of you two. And then DA David Sullivan, if you don't mind. So if you can just go in that order, it'll keep things orderly. And Jack will give you a nudge if you're talking way too long. My guess is that would probably go to Ann's benefit, but I'm just going to be, just to be funny. Question number one. Are there any proactive approaches taking place for wait times for Section 8 housing? What can be done for seniors who have been on the wait list for several years? Question number two, will there be additional COVID relief payments or ARPA funds available for fuel assistance applicants in the future? Will these include additional help for oil or propane as well? And question number three, many low-income seniors rely on community health centers for their medical and more often their dental and vision needs, but the nearest facilities are in Chicopee, Amherst, Gardner, Leominster, Orange, Springfield, or Worcester. What would it take to fill that donut hole with a community health center in Ware, Warren, or Hardwick? Thank you.
Okay, I think, John, I'll take that first question because otherwise you're gonna get everyone kind of repeating themselves. Does that make sense? I'll
Right.
take the first one and then somebody else can go with the other. So as far as the Section 8, as you know, that is a federal program. And yes, you're absolutely right. The wait lists are quite long. What we are trying to do on the state side is to look at ways to create more housing, because that's really the answer to things. You know, it's not to keep people on a wait list or to try to get that wait list down. It's to actually create housing. So just to let you know, a fair amount of money has gone in through ARPA to try to look for ways to increase housing, going into individual communities like Ware and others to look at what the available housing stock may be. But also, we need to kind of look locally at maybe making some changes with some zoning, for areas that don't allow accessory apartments. There's been a big push recently. I met with a group from Western Mass that are really pushing the tiny homes initiative. And I know some of my colleagues probably met with them as well. And there is a bill that Senator Julian Sear has filed, and we're looking to possibly, because it is moving through, that one's moving. And so there may be some opportunities to make some amendments to that will actually create more housing and create the kind of the pathway for communities to follow if they want to make some changes within their own zoning to allow things like tiny houses or accessory apartments. So that's kind of my answer on it, John. There's not a whole lot we can do on the federal and on the wait list, but what we can do on the state side is to figure out ways to create more affordable housing for people.
The next, Jennifer for Senator Lesser.
Thank you. Anne took the best one, to be. I don't have an answer on whether or not there'll be more for fuel assistance. Those distributions are still being made at the state level to come down to the agencies and then to the programming. And whether those will be dedicated to seniors or not, I don't know. And I will pass that on to our reps now who may have more information than I do at the moment.
Thank you, Jennifer. Representative Todd Smoller.
Thank you very much. Jack, a fantastic job by Aiden on that video presentation. So please pass on how proud we are of the participation that he has had in this program, because it was a great way to kick off and certainly well done. Yeah, let me just add to that very quickly before I roll into the question about community health centers. We just did a supplemental budget in the House of Representatives that added some additional funds there for LIHEAP, and the Senate hasn't taken it up yet. So that's one of the reasons it hasn't come on their radar screen yet. I anticipate over the course, I think, of the next month or so that the Senate's probably going to take up that supplemental budget bill, which will help fill some of that gap. I would also say that in terms of those programs, and you're going to bring up other questions relative to rental assistance, to RAFT, to LIHEAP, to issues like propane. We often look at the annual budget as the vehicle or the mechanism where we judge these programs, but please keep in mind that throughout the course of the year, we use a number of different mechanisms that we add supplemental funding to, supplemental budgets obviously being one of them. And then of course, the other tools that we're using this particular year are ARPA, and a couple of other bills are going to be coming around the bend in order to spend some excess revenue and resources that we have. So keep all of those things in mind, and certainly in the House and the Senate, that's what we do as well. When we see that one of these important funds is running low, like RAFT as an example, we look at a supplemental budget and we try and give it an uptick. In terms of community health centers for the region, one of the biggest challenges, I think we all know, and we talk about it every single year, is transportation. So it's difficult when you don't have the service that's directly in our territory to get our constituents from point A to point B, and sometimes point B is very far away. But as far as the community health center goes, I can't imagine that anybody in the legislative delegation would object to one coming in the Ware, Warren, or Hardwick area. I think we'd probably all be for it. The question becomes, how do you make that happen? When the transition of Mary Lane took place under the Bay State Network, and as we talk about reuse for that building, one of the issues that's come up, and one of the things that the community that was surveyed on talked about its reuse, and at the top of the list was turning it into some other kind of a healthcare institution, whatever that may be. So I'm speaking for myself, and I don't want to speak for my legislative colleagues, but I think that you'd probably get a great deal of interest and support in terms of bringing a community health center to a region that is underserved. Having said that, somebody has to be the driving force behind that. Whether it's another healthcare institution that is willing to do it, we're here to work with them and to try and give them any support they need with state resources or even federal resources. And we don't know if they're out there, but we'll work with them on it. So yeah, I would say as far as interest goes, absolutely. I think we'll give it whatever we got.
Thank you. Representative Oliveira.
Thank you. One of the benefits of being the most junior member on here, a lot of my colleagues touched on a lot of points beforehand, but I just piggyback on answers in each one of those three questions. So starting first with the housing crunch out here. If you haven't taken a look at it, Wayfinders has done a wonderful study for the 4 counties of Western Massachusetts that shows kind of the housing needs that are in each one of our communities. And it also compares the median family income for that given community with the median rent and the median home price. And a lot of times that median family income falls well below the median rent or the median housing price. But I think Senator Goby hit the nail on the head. We need to build more housing stock and more diverse housing stock, whether it's tiny homes, whether it's mixed use housing. One of the benefits of the first round of ARPA that we passed last year included significant dollars to construct more housing, including in my hometown of Ludlow. We have the Ludlow Mills project coming in. I know Jennifer knows it well. We were able to secure a few $1 million for affordable housing there. Things like that are very important that we partner up with our local communities, but also our housing departments as well, which have wait lists that are stretching, pretty extensively. I know here in Ludlow, the housing wait list is in the thousands at this point. We need to build more housing stock. When we look at kind of fuel assistance programs, I was actually just working with a constituent last week who does receive a subsidy for propane. However, the propane company was forcing her to purchase more than her subsidy could actually allow. And so they would set a minimum on there, and we're actually working with the Attorney General's office and the Consumer Protection Division to make sure that, the housing subsidy doesn't keeps pace with the rising costs that we're seeing in home fuel oil, whether it's propane, whether it's oil, whether it's natural gas or electric. My grandmother benefits from one of those programs, and a great resource in my communities are our senior centers, particularly for seniors. They can actually help set up a lot of the folks that live within our district with that fuel assistance subsidy. My grandmother gets it. She's 96 years old. We live in the same complex. I pay nearly $300 a month in my electric bill. She pays $50 with her subsidy, and that's needed for those that are living on fixed incomes. And I think, I think Rep. Smola was actually speaking for everybody. We'd love to partner with you if there is a desire to have a community health center in one of the communities mentioned. Count us as supporters and whatever we can do to support that effort. And we're happy to partner with all of you. So thanks again.
Thank you so much. Donna for Representative Berthium.
Hi, good morning. I'd just like to speak a little bit, and I apologize, the rep is still in his phone call, but did want to mention to everyone that we have been working diligently with DHCD in regards to the waiting list. I'm sure everybody's familiar with the CHAMPS program, which is the universal waiting list that is out there now. The waiting used to be centralized, and we're trying to get that trimmed to go back to the old formula. What's happening now, especially in this area, we are a small suburban area out here, and we're having even local individuals that aren't able to get housing here because the waiting list is centralized and it's statewide. And they're pulling these housing authorities and the senior centers, they're pulling all these people from all over the place. So the waiting list is it's unbelievable. And one of the things that we're doing is trying to work with DHCD. Right now, we at least got the congregate housing to be centralized to its own district. So now we're working on getting the rest of the waiting list to a more local venue.
Thank you. Thank you. And let's hear from District Attorney Sullivan. Oh, you're muted, Dave. There you go.
Our legislators have handled it well. It's out of my ballpark.
All right, just wanted to give you your moment. Thank you so much, everyone. And now we're going to hear from Dane Cutler from Community Action Pioneer Valley. If you could read your questions, we'll go through the same order. You're muted. There you go.
Thank you so much, everyone. So you've already answered one of mine, which had to do with RAFT and ERAP money. So thanks for covering that, John. So that leaves me with two questions, one about taxes and one about evictions. The first one is there any momentum for greater eviction protections in the State House? We've heard about housing shortages and people who are homeless and waiting for housing, which is absolutely a desperate and urgent need, but equally so is keeping people in the housing they already have. That is one of our best measures of protection against homelessness. Is there any momentum at the State House or in the Senate for furthering a moratorium, creating a new moratorium, anything like that? Second question about taxes. Ooh, Donna, I think I'm getting some feedback from your microphone. Sorry. Would you terribly mind muting yourself? Thank you. So my tax question, because of course, Community Action Pioneer Valley runs the VITA program where folks can get their taxes done for free. Where do you all stand on expanding and increasing the state earned income tax credit? Right now, our state earned income tax credit is 30% of the federal version. We'd like to see it boosted to 50%. Can we look forward to any support and leadership on that initiative? Thanks so much.
Thank you, Dane. And so you've got it paired to two questions. And let's go round again. Let's first hear from Senator Goby.
Okay, I can take the last one first because it's freshest in my mind. There are a couple bills that are going through on the earned income tax credit, and they had a hearing. It was a late hearing, it was not until the end of December. So the committee that heard those bills have extended that until the end of March. So they're going to make some determination on that. I think that's a good sign that the committee is working on language. And I think you probably know that language does include to go from the 30 to 50% on that. So I expect something will happen with that, but it is making its way through the process. So I don't know what that bill's going to look like, and we'll have a better idea after March 30th on that. And then I think you asked about
eviction
evictions.
Protection.
Yeah. So I think that both the House and Senate had put in some moratoriums, working with the administration. I believe those all expired at the end of December, and I haven't heard of anything to extend at this point. And keep in mind too that we also get a lot from the other side, and meaning the landlord side of things. And trying to help the landlords who were without money as well. So, it's a tricky balance sometimes to make sure, because not every landlord is a slum landlord. We have a lot of landlords, especially in these smaller communities, that may be someone that is renting out an apartment in the home that they live in. And so, and really, scraping by day to day on that. So anyway, as far as I know, I have not heard of anything else at this time. That doesn't mean that something else won't come out, but I think that and again, kind of to go back to that bigger issue, which is total housing stability, and to have housing security throughout, and to try to look at what we've done right and what we've done wrong in the state, and to make sure that we put the money like into the RAFT program, into some of these housing assistance programs from our our youngest folks who are just trying to buy a home to the elderly that want to stay in the home that they've lived in their entire life.
Thank you, Senator Goby. And Jennifer for Senator Lesser.
Yeah, I just wanted to say we've been working with a housing task force here in Western Massachusetts, and we just met with them this like Thursday, and there's a list of items that they're asking for the FY23 budget, including further rental and homeowner supports, as well as extensions on eviction work, as well as a component to compel landlords to comply. We've had a lot of people where judges have sided with the tenants and have had money from Wayfinders and other organizations available, and they've refused it. So we're really working to try to be sure that the system does get some money into the right hands and that people stay housed as long as possible. There is an economic development bill in development. Senator Lesser is at the head of that. So that hasn't come out yet, but we'll be working to get that out into the debate soon and on the calendar and out of committee. And there may be some components with regard to the housing pieces there, as well as the supports.
Great, thank you. Representative
Thank you.
Smola.
Yeah, thank you very much, Jack. I'll just echo what Jennifer and Senator Goby had said. In terms of the EITC increasing it to 50%, I think we're just waiting for a bill to come out of committee. So I think if you get a proposal that comes before us and there is a willingness by the committee to move it forward to the legislature, I think you're probably going to see general support for it. I would put on everybody's radar screen the $700 million tax package that Governor Baker has released. Take a close look at it. It's got tax relief for low-income workers, for seniors, for parents in there. It's, so tax packages, when they come down for tax relief, obviously because they have multiple components to them, there's a kind of a differing opinion about which one does the most good. So that's part of the process that we take a look at it and we figure out where it's going to best help. In terms of the issue on moratorium for renters, Senator Goby hit the nail squarely on the head. The legislature at the start of the pandemic saw the need to be able to waive the requirement that tenants had to pay landlords for a period of time because we were in this, once every 100 years pandemic. It was something that was so unique. We saw the need to act quickly, and we did. But there is another side to that coin. And I think what many people try to do is they try to take the term landlord and they put everybody into the same pot. So if you move to a larger, maybe city type atmosphere, or you move to a place where somebody makes kind of their bread and butter on just being a landlord with multiple units, lots of different buildings, and they may not be the greatest landlords in the world, and they take advantage of the tenants. So that's kind of one scenario. You come out to the rural territory that a number of the legislators that are at this panel here today represent, you're talking about a very, very different set of circumstances for landlords. I've met with dozens of landlords in the region that simply have one excess property that they invested in to pay for their retirement. And ultimately, because of a fee being waived, it put them in an extremely difficult financial position. So there is a double-edged double-edged sword with that initiative. And I think the legislature, when we see that the need is great and when it's across the board impactor, we react to that stuff as we did at the beginning of the pandemic. So I would say nothing is certainly off the table. I'm not familiar, at least at the moment, for a proposal that's going to be coming around the bend again for that type of relief as we did it during the pandemic. However, I would not exclude it. I think when we see that there's a critical mass of a problem in the system, we try to move as quickly as we possibly can to provide help. And I think we'll continue to do that throughout the course of this budget cycle and whatever comes down the road post-COVID.
Great, thank you. Representative Oliveira.
Not to reiterate what my colleagues had already mentioned, but I would just say, I think there is going to be a desire within both branches of the legislature to do some relief for low income and moderate income individuals along the tax side. I mean, with inflation rising right now, the cost of gas that disproportionately impacts a lot of our rural workers here in Western Massachusetts, also with the inflationary rate of food costs and housing costs going up, there is a desire to do some sort of tax relief, whether it's extending the state's earned income tax credit or some relief from renters. You know, a lot of our tax codes are designed, particularly at the federal level, less so at the state, are designed for homeowners and less for renters. So I think there is a desire for us to do some to help out renters on the tax side, but also the earned income tax credit, because it goes to those lower and moderate income folks on that end of the spectrum. As far as the eviction protections and moratoriums are concerned, I would agree that it's a bit of a balancing act that we have to do between the renters that are on there and keeping folks within their homes, within their apartments, so they can pay their actual rent rates, increasing raft for folks that are on there to help them out as well. Those are all kind of the wraparound services that we need to provide to our renters to make sure we keep them within their homes, but we also have to balance it with a lot of the other side of it, which are, you know, the landlords and those that are actually depending on the income coming in for their actual income at this point. So it is a bit of a balancing act that we need to play, but I think there are some common sense reforms that we can make on the tax side, but also on the relief side to help out with a lot of folks that are renters. And probably like myself, I'm probably one of the few renters that's actually a member of the legislature. So I see, you know, when rent rates go up, I see it. When property taxes go up, there's a misconception, I think, sometimes that, you know, you don't pay property taxes directly, but you do. It's folded into your rent a lot of times. So a lot of us, you know, you get hit on there and said, oh, of course, you want to build that new school or that new senior center, you don't have to pay it. I said, no, my rent rate reflects every time a property tax change happens within our communities. And so I think it's important to kind of add that perspective as we're looking at renters and how they get impacted by various different changes. So thanks.
Thank you. And thanks for that added perspective. Donna for Representative Berthium.
Hi. Yeah, I just want to echo what Representative Smola and Senator Goby had stated. A lot of the phone calls that we're getting in our office are more from the landlords at this point than it is for the tenants. The landlords are struggling. We have, you know, elderly people who have their home and they're using maybe a part of their house as income to help them. And right now what we're dealing with is we're helping out with fuel assistance for a lot of the low income people, but the people getting stuck in the middle are the seniors that are on a fixed income that may happen to own their own home, but because they're on a fixed income, they're not able to take care of the fuel for their home, the heating oil. So they're struggling as well. So that's one of the pieces of legislation that we're kind of looking forward to. I did speak to the gentleman from RAF this morning who said that they are looking to put in some additional money. They're hoping with the new supplement budget as well as the FY23 budget that they're going to be trying to increase that. So that's the goal.
Thank you so much. Anything to add, District Attorney Sullivan, before we turn to the Substance Use Alliance portion of the meeting?
Just one thing, you know, from the very beginning, I really felt that the owner-occupied landlords have really gotten the shaft. You know, people that rent to one tenant or two tenants, particularly the elderly, have really been distressed by the entire COVID to begin with, but then you look at all the rent that they depend on for their mortgage, and again, fuel and electric. So whatever relief that you can give to those smaller landlords that don't have the number of units to absorb that loss, I think it's really been a tremendous hardship, and hopefully there'll be something for them as well.
Thank you. And I'll turn it over to you, Gail.
Great. Thank you, Jack. Thanks for all the thoughtful questions and answers. A couple of things just to give you an idea of how we're going to do this. I'm going to make a few remarks about what the Quabog Hill Substance Use Alliance is seeing and is most interested in. Then we're going to hear from our partners at Hampshire Hope and also the effort underway for a regional recovery center with the Western Mass Training Consortium, along with the Healing Community Study. We're going to hear a bit about that. And then we have a couple of questions from the substance use related arena that we'll pose. And then we're hoping to move into the overall comments, questions, reactions from our elected officials. My first comment is all of the issues that the coalition just talked about, housing and income and transportation and access to a community health center, and all of those issues are extraordinarily relevant for people who are using substances, who have substance use disorder, who are family members of people with substance use disorders. So when the policies and the budget look at those social issues, it's going to help folks with both prevention, treatment, and recovery around substance use. So we recognize that those things are all linked together. In terms of what the Alliance is most focused on, we'll be sending information, just to give you a heads up, to all of our legislators. For example, we did a survey back in 2021 of our middle and high school students. And one message to take away, and that was in the midst of COVID and some remote learning. One message to take away is that our data shows that between 2017 and 2021, the percentage of students who are not using substances is increasing. And we like to focus on the positive. So we like to point out the majority of students who are making good and healthy choices. So if there's one message to take away on that note, please remember that they are making good decisions and more students are choosing not to use substances. We're also seeing that there's some growth in the area of peers disapproving of substance use, and that's a good thing. When your peers don't approve of it, you're less likely to do it. We also are seeing that, students are telling us they're not using substances because they care about their health, and they also want to be sure that they are not displeasing their parents. So parents still play a huge role. Couple of things that we are concerned about. Our data shows that we need to potentially pay specific and more direct attention to students who identify as LGBTQ, as well as students of color around both substance use and underlying mental health issues. And you'll see that in the report that we will send to you. A couple of other bullet points that we're most interested in. We really feel the need for more harm reduction services in our region, and particularly mobile harm reduction services. So we're partnering up with groups like Tapestry, and we want that to go the full spectrum of harm reduction. And that includes syringe services, Hep C and HIV screening, testing, information about COVID, along with all of what is part of substance use disorder harm reduction. So we would welcome our legislators supporting both policy and funds around that. We do recognize that we need more treatment providers in the area. And you may hear more about that when we talk about healing communities. We are actively involved with trying to expand recovery and support services locally. So again, people do not have to travel. We've heard from our partners that people have been going to other places to get harm reduction services, to get access to treatment and other providers. The COVID epidemic certainly put people in more isolation, and that was a concern. So you'll see, we'll send you a copy of our updated action plan. You'll see that we are advocating for more mobile services, more transportation, looking at that whole spectrum of treatment and recovery, recovery coaches, peer-driven recovery, as well as access to more activities to keep young people engaged in healthy pursuits, which we know will contribute to that prevention. Let me stop there and turn to some of our partners and colleagues. First, let me turn to Alyssa Curran to talk about the Healing Community Study, a huge federal study that is going to be directly visible in our region.
Thanks, Gail. Good morning, everyone. So I am the Healing Community Study Community Coordinator for Belchertown and Ware, as well as a clinician with the Hampshire County Sheriff's Department at the Community Justice Support Center in Northampton. So just very briefly, an overview on what the Healing Community Study is for those of you who haven't heard. It is a National Institute of Health research project. It's taking place in a combination of rural and urban communities across 4 states, New York, Ohio, Kentucky, and Mass. So the ultimate goal is to reduce the opioid overdose death rate by 40% through a selection of different interventions and strategies. Here in Massachusetts, Boston Medical Center is overseeing the work, where Belchertown and Ware have been grouped together as one of the Wave 2 communities. So the selection process was largely based on the overdose data in each area. And as DA Sullivan's recent report showed, is that the areas around the Quabbin, including Belchertown, Ware, Athol, Orange, we continue to be pretty greatly impacted by the epidemic. So I am a grateful employee of the Western Massachusetts Training Consortium, who oversaw the efforts for Holyoke, one of the Wave 1 communities. And at many of my meetings with Boston Medical Center, Holyoke is already emerging as one of the gold standard communities from Wave 1. So with the consortium and Gail being a community advisory board member, I feel like I'm in really good hands to represent the communities. So right now, in terms of the timeline, we're in what's called phase 0, and that's essentially the 6-month period between January and July. January is when the Wave 1 communities completed their intervention phases, and Wave 2 is when, or July 1st is when Wave 2 begins ours. So right now we're building a healing coalition on the foundation of the existing groups like the Alliance, Belchertown Overcoming Addiction Together, the Ware Regional Recovery Center. Sorry, my cat is eating flowers. So in addition, you know, we've talked about a lot of the issues that are already emerging and that we've known about. And for Ware specifically, the numbers are pretty staggering for overdoses. And I think, you know, the closure of Bay State Mary Lane, the isolation with COVID, it's really been tidal waves for those of us who, you know, we already feel like they may be drowning in the area in terms of trying to get access to help. So I'm hoping that the communities that heal interventions, the CTH interventions, will not only allow us to get our heads above water and catch our breath, but will ultimately be sustainable enough where folks can swim back to their loved ones on shore. Yeah, like Gail said, I mean, the lack of providers is an area that we really want to focus on, but there's already been a lot of inspiring conversations. So the next meeting that I'm having for the separate healing coalition is actually tomorrow from 1 to 2:30. We will have Boston Medical Center staff available to help answer any questions. So if you have not got that invitation, just let me know and I will make sure you are on the email list.
Great, thank you, Alyssa. It strikes me as well that if we don't yet, and I think we may, but we'll get our elected officials on the list for just some periodic updates about this study, because we are very fortunate to have part of this large research effort in our communities, and we'll keep you updated as that unfolds. Let me turn to our colleagues. As Alyssa noted, lots of work already going on in the area to look at opioid use disorder and specific aspects of that. But let me turn to our partners in Hampshire Hope. Let them have a few minutes to talk about their efforts, and then we'll hear more about the Regional Recovery Center efforts.
Hi, good morning, everyone. Thanks, Gail. My name is Michelle Fari, and I sit in an office in the Northampton Health Department, but we coordinate a multitude of programs out of the health department that impact all of Hampshire County, as well as the Quabog Hills and the intersecting communities in Hampden County, as well as touch points from Worcester County West, as we look ahead on our many intersecting agencies and providers that are serving our populations. The program that I just want to give a quick update to everyone that provides some direct service on the ground level for the Quabog Hills Coalition is called the Drug Addiction and Recovery Team DART program. Some of you know about it. Born from this program was a first responder public health, public safety collaboration back in 2018, which has grown substantially and now includes I was just looking at the slide because we presented to the Quabog Hills last week. I think we have 20 communities in Hampshire County that are part of DART, 9 communities in Hampden County, and 32 communities that are coming on board in the Berkshires, which are doing an EMS first responder model versus a police model, which is used in the previous communities I mentioned. We've distributed a record amount of Narcan as we were pulling some of the data for this presentation. In Ware alone, the police department, in collaboration with the Quabog Hills and other recovery associated organizations, 300 kits of 2 4-milligram doses in just Ware. And I haven't pulled the data for all of the other communities that surround, but it certainly does give us the data to know that the need is there, the engagement is there and willing if we're able to find the right ways to approach people with a person-centered and a harm reduction based philosophy. So our program, DART, that's operating in the Quabog Hills is a little bit different, where we really just want to make connections with folks. We want to be there offering free recovery coaching services for people that may be in crisis after an overdose, may have had an intersection with law enforcement due to substance use, and a lot of network and family association support. So 6 out of 10 of our participants do result in being family members, friends, or allies, which we have learned over time, and especially during COVID, shoring up people's systems, especially when there's chaotic drug use involved in a household, can be huge. And it can help reduce overall impacts and risks for everyone involved. So our program is really comprehensive and making networks of community partnerships, looking at data and evidence-driven, evidence-based strategies. I'm trying to be so quick because I know Gail said we have 3 minutes. Really looking at technology to drive innovation. So from the DART program's early conception, we developed a HIPAA-compliant case management system that we could integrate with partners such as behavioral health, healthcare, our PD systems, all with role-based permission level access that was looking at protecting people's trust in the program and the data that we collect as part of it. So we're happy to provide more context and detail on examples of cases and the kind of complexity that's seen in the Quabog Hills with the rural anonymity, stigma, accessibility, lack of providers, as already was mentioned, transportation, all things this group have made accolades in achieving during COVID. So I'm very proud of the work that's being done with our partners. And I really want to thank the Quabog Hills and the consortium with the Western Mass Training Consortium's efforts with the Regional Recovery Center and continuing to build our assets and funding collaborations so that we can provide resources and be more equitable in the accessibility of things that we know our populations really need. So that's a little bit about DART. In my role in the Health Information Exchange, we've got Austin Sanders here today, who's part of the Healing Community Study and our data inventory that we've been building as part of an extension of our case management system, which really helps us understand the community context and how people are moving through systems and gaps. And then I'm going to introduce just one other of our programs. In addition, we're happy to talk about more at another time. But civic and business outreach is another initiative we're working very hard on. So Kyle, I'm going to introduce you for our justice work.
Thanks, Michelle. So I'm Kyle Engelman. I'm a consultant with Hampshire Hope. I've been with them, gosh, coming up on 2 years, and specifically was brought on to help with a grant that we had to reduce overdoses among folks who are justice involved. And so we're defining that as anyone who has either been incarcerated, on probation, on parole, interacted with the criminal justice system. There's obviously, as you all know, a lot of overlap with folks with substance use disorder who have that background. So what we had a great 2 years, big needs assessment, lots of partner meetings, and identified a few key areas that we want to focus on for this county around improving access to transportation, to employment, more family support services that could be available. And ultimately, where we're looking to head is recognizing that a lot of these services already exist in our county from west to east, but that there really isn't an aftercare model where folks who are leaving the justice system have a place they can go to get peer support, case management support, and really have someone that ties together, helps them tie together and navigate what's happening once they're back in the community. So, you know, we're currently writing grants to pursue that model. We're working with all of our partners and legislators to bring this into fruition. And it would be something that we would do on both sides of the county. So we imagine it being housed at both the Northampton Recovery and the Ware Recovery Center so that it's accessible to people in Quabog Hills area and the eastern part of the county. And then also that it would be a hybrid model where some of these services could be accessed through, you know, teleconferencing. If we're able to arrange transportation, people don't necessarily have to get themselves to the recovery center just to have access. We could even help get them to appointments. So it's all coming together. There's some great initial piloting happening at the NRC, and really looking forward to bringing all of it to the eastern part of the county as well. All right, Gail, back to you.
Thank you, everybody. I appreciate the attempts at brevity. I know how much exciting work is going on. And also, as I said, we are likely to be sending information to our elected officials and their staff members after this meeting, just to give you even more background. So thank you. Let me turn to our partners at the Western Mass Training Consortium and the Ware Regional Recovery Center to give us an update, and want to also acknowledge just Representative Smola's efforts in the past to secure us some funding that has definitely contributed to the expansion of those services. So I know that Abigail is here as the coordinator, and I know Crystal is here with the consortium. So I'll turn it over to either or both of you.
Crystal, do you have any notes that you would like to introduce first?
Go for it, Abs.
Thank you, Crystal. Well, thank you, everyone. I am Abigail Duda, and I am employed part-time in multiple positions related to substance use prevention, treatment, and recovery. I've been recently hired as the project director for the Sober Truth on Preventing Underage Drinking, which is also called the STOP Act grant. And for the past year, I have been the community engagement coordinator for the Quabog Hills Substance Prevention Partnerships, both of which are projects of the Town of Ware and the Quabog Hills Substance Use Alliance. The Alliance laid the foundation for the Ware Regional Recovery Center, a program of the Western Massachusetts Training Consortium, for which I've been the peer project recovery coordinator now for 2 years. Hard part's done. So the dream of a recovery center representing 18 towns started when there was a prior period of critical overdoses in our area. And we find ourselves in a critical period again as we emerge from the pandemic. Despite the pandemic, though, our recovery center has been moving forward with a strengths-based approach and a community-based approach. We are so proud that we have a great space on the second floor at 6 South Street, thanks to the support of the consortium. And last year, we were also fortunate to be awarded a grant from the Bay State Wing Hospital. The grant was made possible following a critical earmark in the 2021 state budget by Representative Todd Smola. Thank you so much, Todd Smola, to support public health-related programs. Our work focused in 3 major areas. We wanted to establish a recovery coach program. We wanted to work towards reducing stigma, and we wanted to increase access for harm reduction. The Recovery Coach program began with the selection of Sue Daly. Many of you in here, I'm sure, know of Sue. She's a well-known, well-respected recovery coach, and she is a member of the DART program, which Michelle told you about just a few minutes ago. We trained and currently have 2 active recovery coaches in the area, and they have also recently joined the DART program for training. To reduce stigma, with the help of many partners in the community, we attended 11 community events, reaching more than 500 people with our engagements across this area of Western Mass. Another important initiative, and a really fun initiative, was organizing Bringing Awareness to Recovery, which is an art exhibition held at the Artworks Gallery on Main Street in Ware. It featured 23 works by 9 artists and was so successful that at our public opening, we agreed. We loved it. And thank goodness, so did Workshop 13, because they have agreed to host that ongoing on September, which is Recovery Month. So thank you, Workshop 13, and our partnership. We're also pleased to say that the Ware Cultural Council is helping to support that with some funds from their available resources. In harm reduction, we have been distributing Narcan monthly since 2020. But last year, thanks to all of those outreach opportunities and thanks to our ongoing monthly distributions at Grenville Park, we were able to distribute 174 boxes of Narcan. Thank you, Hampshire Hope, for providing that to us. The year before, our total number was 45. So again, a drastic increase, and we plan to keep going and increasing that again this year. Also in July, the local television station WWLP ran a segment called Farmers Market in Belchertown Educates About Narcan. And that was an interview with Alyssa Curran, who you just met, and myself. This year, 2022, we are calling this our year of hope. And building on our momentum from last year, we have a new name for our center. Thank you to all of our community members. We are calling it the Recovery Center of Hope, healing ourselves and peers everywhere. We're working on a new logo, and we have a new dedicated website that we're raring to go and get started. We also have a new schedule. 6 days a week, we have all recovery meetings, we have wellness activities, and we have sober social activities. What do we want to do now? This year, we are approaching United Way for funding, thanks to our relationship through the consortium and with our mentorship from the Northampton Recovery Center. And we are poised to apply for funding through the Massachusetts Bureau of Substance Addiction Services, also known as BSAS. Our goals include expanding our recovery coach program. We would like to have at least 2 more coaches to add to our services in the region. We want to include more Narcan training, to have more people who can train others and to educate the people in our region about overdose awareness and using Narcan so that we can continue to distribute more effectively. We want to reach out to more communities. We are serving 18 communities, and that is daunting but doable. And we want to move into an accessible space that allows for meetings and activities on site. That we are very grateful to our partners who are allowing us to share space with them. And I just want to say a thank you. Thank you for letting me refer to my notes so I wouldn't forget a thing in my few minutes. And thank you so much to our partners, the community members who have been welcoming to us and supportive of us, and to those who are able to work with us to help us realize our goals this year and beyond. We really appreciate it during this critical time. And thank you for your time.
Abs to your contributions, if I may, Gail, I just want to add, hi everyone, I'm Crystal Appleby, Executive Director of the Western Mass Training Consortium. And we've had the good pleasure of supporting the community and the strength and partnering with QHSUA in our work with Ware Regional Recovery Center to really take the vision that folks have had and create the capacity for that. Abs, I want to lift up your leadership. You came to a community meeting and true to the consortium's roots, looking at community and staying curious, not assuming the consortium's the experts, but folks with lived experience who have that opportunity to contribute is what is going to sustain the recovery center. So we're just really excited about the new name, the new logo, and all the shoulders of folks we stand on in creating sustainability. The consortium's home to the Recover Project, which was this first state DPH-funded recovery support program in the state of Massachusetts, and then Northampton Recovery Center. And we still don't purport to be experts. Again, where you all have your own vision, and we are so excited to support that. I want to give a special thank you to all the legislators today, but to you, Representative Smola, you really helped us catapult our work this year. And so thank you so much for that. And Gail, for your leadership in supporting ABS and the community members who are contributing every day. Thank you.
Thank you, everybody. I have to also thank Hampshire Hope for linking the consortium and the alliance and all of these groups together. As was noted, now we're bringing in the arts and culture and community groups and other organizing groups, and that's just been a fabulous partnership and great synergy. That brings us to the end of hearing directly from some of our partners. I'm taking a look at our clock. I know we're running a little bit behind schedule. I think what I'm going to do is I've got 2 questions that the Alliance wanted to bring to the attention of the legislators. And maybe what I'll do is pose the question, see if there are thoughts and comments. I'm not sure we have time for every elected official to potentially respond. We can certainly follow up with you. But then I also want to allow at least a few minutes for some general thoughts, comments, reactions from our elected officials. So I'm going to read one question that came to us from Mark Klee from Bay State, one of our very strong supporters working in the healthcare field. Then I will turn to one of the Alliance staff, Ari Williams, who's going to ask a question, and then we'll open it up for further comments. So let me just, if you can indulge, because Mark wrote an incredibly eloquent question, let me lay the groundwork for this. So the question is, the opioid epidemic has accelerated during the pandemic, and rural communities have been especially hard hit due in part due to a lack of access to one of the most highly effective treatments, methadone. Because of highly restrictive federal regulations, methadone can only be prescribed and dispensed out of an opioid treatment program when used to treat opioid use disorder. Ironically, if you change the indication for that methadone to pain, any provider with a license to prescribe controlled substances can order it, and it can be picked up at the local pharmacy. For patients living in Ware and surrounding communities, the closest methadone programs are in Worcester, Orange, or Springfield. Due to the challenges surrounding public transportation, if one doesn't have a vehicle, it can take up to half a day to make it to and from a clinic on a daily basis if you are receiving methadone. This effectively eliminates methadone as an option for many patients. I'm a pharmacist and I still occasionally forget my medications. I can't imagine what my compliance would be if I had to drive 45 minutes in each direction to get my medications. Question is, would you all be willing to work with us to get an opioid treatment program with methadone in this region, or alternatively, look at mobile methadone vans, which could go to these communities on a scheduled basis? So let me stop there and just see if there are thoughts and comments from our state senators and state reps about willing to work with us on that.
Yeah, I'm sure that anyone here would be willing to work on things. I'm a little bit on the mobile unit. I would just be kind of curious because I haven't heard much about those. Is that something that's being used fairly widespread throughout the state or not? I'm just kind of curious what, and if there has been any push to do that, so to speak.
I'm happy to take that question, Gail, if that's okay.
Sure, I was going to comment on Tapestry's work as well, but go ahead.
Yeah, there was actually some phenomenal models that were happening through Healthy Streets in Boston back about 4 years ago that launched, and they were really, really successful, done in partnership with Boston Medical Center. There's been a lot of talk about Tapestry, our harm reduction partner, adapting this model to what looks and fits better for us in Western Mass, and especially more for our rural communities than brick and mortars in the more densely populated areas. Coincidentally, with the COVID changes to the methadone emergency laws that were enacted by DEA, there's been an extension put in place, and there was a very significant 2-day conference held by leadership from CDC, DEA, many different federal justice partners discussing how the heck to even go about changing this regulation with all the different agencies at the government level that are involved. And one of the first steps was taking out DEA as part of that process, and ethically, should it be now moving forward with all the lessons we've learned from when it was enacted. So I think federal changes are well underway, and the providers have made great accolades in designing COVID strategies to meet people's needs, and pharmacies to meet those needs as well. So we expect mobile outreach, potential BSAS licensed methadone distribution happening outside of the what was known as like private standing methadone programs. And they might be for short-term or regular long-term use and engagement by community. So there's a lot of visioning in place, and there's a lot of work being done around the stigmatization of methadone as an evidence-based treatment, and actually one of the most safe and used treatments for substance use, and specifically opioids, especially even for parenting and pregnant women. So there's a lot of reasons why having methadone and access to different medications that are the gold standard for treating substance use are really important in the diverse population needs and health needs.
And I'm not trying to put, Molly, I'm not trying to put you on the spot, but I'm just kind of curious because you mentioned, Michelle, about the partnership a few years ago with the Boston Medical. So I'm just kind of curious, Molly, so would that be something that Bay State, since you're the largest in this area for healthcare, that you would have to partner with them? I'm just trying to understand how it works. So, I mean, do you need them, I guess?
So we do actually operate a Suboxone clinic at Bay State Wing Hospital. It's not a methadone clinic, but yeah, we are interested in supporting the effort as well.
I might add as well, Senator, and thank you, Michelle and Molly, for your thoughts, that there also, there are programs and pilot programs looking at not only mobile methadone, but also just other alternative, innovative ways so that people do not have to go to a place daily. So whether that's a lox box with multiple doses or other ways that we can reduce that stigmatization of daily waiting at a physical location to access your methadone. I would imagine, as Michelle noted, this would all need to be done within the context of our Department of Public Health, within the federal and state level regulations. I guess for our region would certainly be open to being even a pilot location. Oftentimes, that may happen before anything is adopted in a more widespread way. Other thoughts or comments and questions from any of our other elected officials on potentially partnering and working with us to make methadone more accessible and available in our region? It looks like to me, Representative Smola, and then I saw DA Sullivan as well.
Yeah, just very quickly, again, I'll echo what Senator Gobi had said. We'll work with you on anything. I mean, ultimately, at the end of the day, we don't come up with the greatest ideas. We rely on people like you that are the experts in these fields, and then come to us and we work on that stuff. I just want to quickly say on the recovery center issue, and I appreciate all the kind words people are saying. I work with a great legislative support team in Senators Gobi and Lesser, Representative Berthium and Oliveira. That's not something that I did alone. We did it jointly as a group, and to just jump really quickly ahead for 30 seconds on one of your other questions relative to earmarks for recovery centers, the way that we pursue earmarks in the budget or other funding is when you bring us great ideas. And so when Bay State, in partnership with working with some of you to talk about the need for recovery center funding, we huddled as a legislative group and said, hey, we're in, let's go for it and let's see how it works. And clearly, based upon all the wonderful feedback that we've gotten, it is paying off in spades. So I would say that, certainly that's something that we will continue to work with you on, and we rely on you giving us great information and helping us kind of get there. So job well done on your end. Just absolutely impressed and phenomenal performance. Thank you.
Great, thank you. Didn't mean to diminish the role of the team there. I know the Western Mass delegation always works as a team on so many things, so we really appreciate that. And absolutely, we are formulating ideas. We are looking constantly for other sources of funding. And as was noted for the Recovery Center, the consortium will be looking at that BSAS funding as soon as that request for proposals is issued.
Gail, I just have one quick thing I wanted to introduce to the group. As part of the DART program, we pay for recovery coaching services that fall within a harm reduction framework with our federal grant funds. There is no other source of revenue currently to be able to compensate recovery coaches outside of the medical billing model, and that isn't even the same between private insurance and federal and state. So we really, really need funding earmarks from the state legislator, not to be extremely competitive alone when we apply for federal grants to show the state's investment in our programming, but really to be able to have more flexible funding use than adding more initiatives that often have to come as part of additional grant funds. We need to really have the sustainability and fortitude with what we have. And I'd be happy to make any recommendations, but for sure, advocacy on earmarks for the state would create a continuum of care for us and a experience for people that does not run short lifespans of grants and initiatives, but shows a more holistic approach that has continuity as people flow between the different cities and towns in the Quabog Hills. Thank you.
Thanks. Always needing to look at sustainability as well, even though much of our work is often grant funded. Let me go back to DA Sullivan. Did you want to comment at all about around the issue of methadone and access to that in our region?
Yeah, what I want to say is that, methadone has a lot of stigma behind it, which is really unfair because it is a great method of treatment for a good number of people. And I think that the more that we can kind of overcome that, the more acceptable it will be. And I think certainly there's a real desert of treatment for methadone in the Quabog area. I mean, you've got Orange way up north, and then of course Holyoke or Springfield, are the other closest. And it's unworkable for working people, in people that just don't have transportation, as we all know that transportation doesn't work for a good part of the region. So I'd really encourage it. I'd love for Bay State or some other provider to take the lead on that. And I think as we transition, Mary Lane, I think that's again some area that should be open for discussion about how you can have a community health center that would also provide those medications such as methadone.
As was noted in the chat as well, that's often part of a broader community health initiative as well. I know we're running out of time, but I did want to let Ari Williams just pose a quick question so that we would not forget about this particularly important issue that we're hearing a lot and seeing in our own student data as well.
Hi, I apologize. It's really hard for me to hear with the camera on due to my connection. My name's Ariana Williams. I just go by Ari, and I'm the Substance Youth Coordinator for Quabog Hills Substance Use Alliance. My question is, the U.S. Surgeon General has issued an advisory to highlight the urgent needs to address the nation's youth mental health crisis. What is happening on Beacon Hill to address this in our state?
I can jump in real quickly. I know the time's getting getting short. The Senate had passed a bill, actually, this is our second bill that we've passed about mental health, and we passed it at the end of December, and it's over in the House now, and I'm sure that my House colleagues are working diligently on it. But it provides a number of updates to our behavioral health system, specifically aimed towards youth. In addition to that, it also would put about $122 million to retain people who are who work with youth, because we know that don't get paid enough. And if you can't pay off the loans that you accumulated during your schooling, you're not going to stay in a profession that doesn't pay well. And so that is a big part of it, to make sure that we're retaining people and encouraging people and get a real pipeline going of people to go into the social service field. So a lot was done on the Senate side, especially with the whole boarding issue, and Molly's very familiar with this, with what happens in our emergency rooms. So there is something moving, and again, I know it's over in the House, and I'm sure that they will be making the priority before session ends in July.
That's Standish, huh? Must be.
Jennifer, did you want to add to that? I saw you unmuted, and I just want to give other elected
Ann said it
officials a chance.
perfectly. And we can send you the summary of what the Senate did, but it's not, as she said, it's still moving through the legislature, and so it might be better just to wait, but there is movement.
Great, thank you. We appreciate that. As we've seen in our prevention work, underlying mental health conditions often contribute to substance use. So we know that those two things are very closely linked, along with a variety of other health issues. I know we are past our time. I just want to give any space, and I know some folks have had to leave, but just any final thoughts or comments from any of our elected senators and representatives who are here. Anything we can provide for you as follow-up to this meeting.
Gail, let me kick things off. Thank you, everybody, for participating. We had in excess of 50 members that participated here at the start, and that's pretty impressive. Hoping that we're going to be able to do this in person next year as we get back to reality. It's good to see faces that are in person, but actually virtual platforms have done a lot to bring people together too that couldn't otherwise make it to meetings. So there's pluses and minuses to both. But in terms of information and the important things that you are dealing with through your organizations, make sure that you share that with us. The way that we mold policy, that we shape budget requests, that we go after different resources, both on the state and the federal level, is by getting well-informed information that comes from all different kinds of sources. So please keep that coming. You're not shy about sharing it with us, and we are grateful for that. I do want to single one person out who is on the Zoom today, and that is Eileen Kennedy from Turley Publications. For those of you that don't know, Eileen is going to be retiring, and she's moving on to the next stage of life in the next few weeks, believe it or not. I want to single her out because with all of the good work that is done through this organization and many others, Eileen is a person that comes to our Zooms, she comes to our meetings, she goes to our domestic violence walks, she pays attention in our communities. She's done an outstanding job at the local level, and most people get connected to their information by picking up the Wherever News or the Journal Register or the local publication. So she's just done a phenomenal job at that, and I am so sorry that we're going to be losing her, but I wish her well in her next stage of life. So Eileen, thanks for everything that you do for our organizations. We're grateful to you. Thank you.
Thank you very much.
Thanks, Eileen. Appreciate all your work.
Thank you.
I would like to thank everyone. I know you also have some stresses on the clock. I need to go to my next meeting, and I want to, on behalf of the Quabog Hills Community Coalition, thank you all for participating in our annual meeting. And yes, next year, I'd love to see you in real life.
Thanks, everybody. Congratulations again, Eileen. Thank you all. And next month, we're back to our regular meeting.